Hello, and welcome to a Rock or Something podcast. I am Specialist Lynnwood Thomas, and today we will be speaking about Men's Health Awareness Month. I'm joined here by a special guest. Can you please introduce yourself? Tell us a little bit about what you do.
Sure. My name is Major Corey Campbell. I'm a physician assistant, currently deployed to Camp Bondsteel, Kosovo, and I work as the Task Force Med physician assistant as well as the Brigade Senior PA.
Okay, thank you for joining us today.
Yeah.
So first off, I'm going to talk about Movember. So Movember is a word that is taken from mustache and November, obviously, because this is Men's Health Awareness Month, and that falls in November. So there's a foundation called the Movember Foundation that promotes men's health. It started in 2003 in Melbourne, Australia. It was a couple guys that got together, decided to grow out their mustaches for the month of November just in support of some causes, and it got really popular. They've now raised about $837 million, funded over 1,200 projects in more than 20 countries. Are you aware of the rules of Movember?
In preparation for this interview, I looked up on the website and looked at their foundation, so a little bit familiar, but just for those purposes only.
Got it. So the rules are pretty much you begin November 1st with a clean-shaven face. You grow and groom a mustache for the entire month, and no beards are allowed. So that means no connecting sideburns or chin hairs to your handlebars. And that's about it. So Men's Health Awareness focuses on some key topics. So we'll just go through a couple of them and see what you have to say. First off, there's prostate cancer. For those who don't know, the prostate is a small walnut-shaped gland in men that produces the seminal fluid that nourishes and transports sperm. The American Cancer Society says this about prostate cancer. Prostate cancer is one of the most common types of cancer in men. About 1 man in 9 will be diagnosed with prostate cancer during his lifetime. And prostate cancer is more likely to develop in older men and in African American men. So just jumping right into it, what are some warning signs of prostate cancer?
So if you're having any urinary symptoms, that can be a sign. And with any type of cancer, you can have certain signs and symptoms where you have unexplained fevers, sudden weight changes, night sweats, those sort of things. Those would be concerning. Oftentimes, though, with prostate cancer, some of those symptoms don't present until later, when it's sometimes been a little bit longer as for the cancer to develop and possibly even metastasize. Yeah, those are some of the signs and symptoms you want to look out for.
Okay, so a few other things that I saw were burning or pain during urination, loss of bladder control, blood in your urine or semen, painful ejaculation. How exactly is prostate cancer checked?
So historically, we used to perform a procedure called the digital rectal exam, but that has fallen out of favor. Current research supports using a lab now called the prostate-specific antigen. Whenever there's a suspicion of prostate cancer, or if the provider and the patient, after they reviewed the risk of being tested for prostate cancer, both agree, we'll order the lab and screen the patient for that specific lab. However, that lab isn't specific for prostate cancer. Other types of conditions that can occur when that lab is elevated would include BPH, or benign prostate hyperplasia, prostatitis, which is an infection of the prostate. Those infections are bacterial, which can be from E. coli or even sexually transmitted diseases.
Okay, so I had heard of the PSA test. So is that like blood work? Is that just a simple blood draw and then you send it off for a test?
It is, yeah, that's all it is, a simple blood draw. Sometimes we'll also just throw in a urinalysis, especially with any type of urinary symptoms, because there could be a urinary tract infection that we want to make sure we rule out or that the patient doesn't have. But yes, that's specific or it's sensitive for prostate cancer, but it can pick up other types of conditions as I previously mentioned.
Okay, so when should a man begin being tested for prostate cancer?
So in the military and in most primary care clinics in the United States, they go off the United States Preventive Task Force recommendations, or USPTF, which for the males between the ages of 55 and 69, they have a grade C rating, meaning that it's selectively recommended. So that's where there's a conversation between the provider and the patient, and we talk about the potential risks of having a false positive lab, as well as the potential upside of catching prostate cancer early.
What constitutes a false positive?
So that happens whenever there's an elevated prostate-specific antigen test, and we go through the steps, which would be referral to a urologist in most cases, and where they'll do a transrectal ultrasound, and then if there's still suspicion of prostate cancer, then they'll do a biopsy of the prostate, and if they still can't find it, then it would be considered a false positive.
So a biopsy is them getting a piece of the prostate, or?
Correct, yeah. So usually they'll have a needle or needle core biopsy of the prostate, which will then go to a pathology lab, and then they'll look under a microscope and see if there's any cells that are suspicious for cancer.
Okay, so this is a progressive series of testing.
It is, yes. So, like I said before, the PSA, it's sensitive for prostate cancer, but it's not specific. So it can pick up other conditions like the BPH as well as prostatitis. So even if it's elevated, it doesn't necessarily mean you have prostate cancer. You want to look at the whole picture, see if there's something else that might be causing it, maybe run some other labs, especially dependent on the age. But it's not always going to be specific to prostate cancer when that lab is elevated.
Got it. Okay, so what is recurrent prostate cancer?
That's where the treatment modalities we have right now, you either irradiate the prostate or sometimes they completely remove the prostate. In those cases, you wouldn't have a recurrence. However, if they use irradiation and there were still symptoms started presenting again, and then they did another biopsy and found it to still be present, then it would be considered recurring.
Okay. What are some treatment options for a prostate cancer diagnosis?
So again, to be handled by a specialist, typically it'd be in conjunction with a urologist and an oncologist. But from what I understand, and because I'm obviously not either one of those, I'm just a family care physician assistant. Radiation is a treatment, or complete removal, also called a prostatectomy.
Okay. So I guess a huge question would be if prostate cancer can kill you.
Yeah, so over time it can. I remember actually in school they would, the kind of running joke was if you live long enough, you'll eventually get prostate cancer. But if left untreated, it could eventually metastasize into other organ systems. Typically the bone system first, and then following other organs as it progresses. But yes, it can eventually metastasize and get to organs that are vital to sustain life and then kill you.
Okay, so the American Cancer Society has prostate cancer as the second leading cause of cancer death in American men, behind lung cancer. It also says that 1 man in 41 will die of prostate cancer. So would you say that's a pretty big number?
1 in 41? Yeah, I would say that's concerning, but it's still relatively rare when comparing to the frequency of patients dying from lung cancer.
Right. That makes sense. Okay, so another focus of Men's Health Awareness Month is testicular cancer. Stats say this year an estimated 9,560 men in the United States will be diagnosed with testicular cancer. About 1 out of 250 men and boys will be diagnosed with the disease during their lifetime. And it's estimated that about 410 deaths from testicular cancer will occur this year. What are some signs and symptoms of testicular cancer?
So typically we'll have patients that, I've had a couple cases of this, and typically it'll be patients younger. The age range most commonly is between the ages of 15 and 34. And they'll come into the clinic complaining of either a growing mass or possibly pain in that area. But typically it's a mass that they can't really explain, and then we do a further evaluation to see what's going on.
Okay, so I saw a painless lump or swelling on either testicle, pain, discomfort, or numbness in a testicle or the scrotum with or without swelling, change in the way a testicle feels or having a heaviness in the scrotum, dull ache in the lower abdomen or groin, sudden buildup of fluid in the scrotum, breast tenderness or growth, or a change in size or a lump on the testicle. Can you speak to any of those that you didn't?
Yeah, so most of that just supports the whole change in size of the testicular area. So especially if it's asymmetrical, if there's one side is getting larger than the other for unknown reason, you definitely want to come in and get it checked out so we can make sure that, one, it's not testicular cancer and figure out what else might be causing it.
Okay. How exactly is it diagnosed?
Typically, I would refer a patient for ultrasound testing. An ultrasound technologist will evaluate it, and then a radiologist will take a look at the images and see if it's suspicious or not for a cancer-causing tumor in the testicles.
Okay. And I also see blood tests or an actual surgery to remove a testicle. Like, at what point is it that serious?
So if there is a high suspicion for testicular cancer, then a urologist will typically perform an orchiectomy and remove the testicle. But other treatments can be done as well, to include radiation therapy, chemotherapy, depending on the disease stage and tumor type.
Okay, so we talked about first removing a prostate and now removing the testicle. Can you live without those?
Yes, you can. So for the prostate, if it was removed, there may be some level of incontinence or difficulty holding your urine. So there would be some lifestyle changes for that. For a testicle, as long as you have the other testicle intact, you can still procreate or have kids. But if for an unfortunate reason you have to remove both testicles, then you wouldn't be able to, of course.
Right. So there's no way to prevent testicular cancer. So when should a person see a doctor about it?
So if they've noticed any type of large painless lump like you mentioned, or even sometimes painful, any type of mass that they're concerned about, for late stages, just like any other cancer, if you started having unexplained fevers, weight changes, night sweats, you definitely want to come in right away. But for testicular cancer, it's usually pretty slow growing, and an unexplained large mass is what usually is going to happen first.
Okay, when we spoke about breast cancer a few months back, the doctor did not recommend self-examination. What's your stance on self-examination?
Yeah, so it's not my stance, but again, it's the United States Preventative Task Force, USPTF. They give a grade D recommendation, which is not recommended to do so. So that's what we follow in the military, and that's what I tell the patients, that there's not really a benefit to do self-testing on any type of frequency of occurrence. So,
Is there any particular reason for that?
it's mainly about the benefits of detection and early versus the harms of detection and early intervention. So, if you have what we talked about, having a false positive, just like we talked about with the PSA lab for prostate cancer, then you have to go through all these different types of diagnostic tests, possibly also a needle core biopsy of the testicle, which has possible complications such as infection, difficulty with other difficulties that involve the testicles. And so you have to weigh those hand in hand with the idea of early detection. And with that being said, and given the research, the United States Preventive Task Force doesn't recommend for self-examinations.
Okay. Do either prostate cancer or testicular fall under the hereditary category? Like, is it something you get from your family?
Like, is there a genetic component to it? So, yes, there is. That is a potential risk factor for both. And it's a conversation specifically with prostate cancer that we have with patients. So, for example, if you are a patient that's African American, if you were a patient, and then you also had a family member develop prostate cancer at a relatively young age, then I'm going to most likely recommend that we perform that lab, at the very least just to get a baseline and see where you're at, and then maybe discuss doing annual blood tests just to make sure that if it does change that we identify it and get you the proper specialist.
That was annual blood tests?
And that's a conversation that we can have, but yeah, that's something that annual versus whenever symptoms do arise that we talked about with the urinary symptoms, and specifically with prostate cancer. But yeah, there's not necessarily a recommendation that I'm aware of.
Another big topic for Men's Health Awareness Month is mental health issues such as depression and suicide. Here at Iraq or something, we have discussed suicide a few months back, so we know that it is a good idea to include it in the conversation, make a conversation of it, get out in front of it, if you will. But we'll focus on depression here. How do you know if you're depressed?
So there'll be signs that you would definitely start to see, especially if you're a colleague, friend, or family member. You would have loss of appetite, difficulty sleeping, possibly feeling down, depressed, hopeless, those sorts of, maybe there's, signs at work where you're not necessarily engaged as much, not conversating as much as you typically do. Yeah, those are some of the things you might see change with someone who is going through a depressed state.
Okay, so if someone thinks that they are depressed, what should they do?
Well, definitely talk to somebody. So here at Bondsteel, we have primary care providers, but we also have a behavioral health staff that includes a psychologist and a behavioral health technician. And both of them are more than capable, as well as the primary care staff, of discussing what the patient is going through, if it is depression, and then also talking about a treatment plan, which can range anywhere from psychotherapy to medication, or a combination of that.
Does depression fall on a scale? Like, are there levels?
Yeah. So we kind of have a mild, moderate, severe depression range, and it's usually via a patient health questionnaire. So we'll ask a series of questions, and the answers are, how often do you experience these types of symptoms or these types of feelings over the last week or two, and if they have it, more often, like more than half the time, versus once a week, versus every day, and then that'll give us a number, and then we add up those numbers, and if it's in each individual range between mild, moderate, and severe, it kind of gives us an idea of where they're at.
So, what are some reasons that a soldier might suffer from mental health issues?
Yeah, so if they're going through a family issue, maybe back home, and they can't really help a certain way, that might get them down. If they're having issues at work and maybe they're not getting along with their boss and it feels like there's just nothing they can do about it, that's maybe an issue where they might feel depression, or they just might feel homesick and they just want to, be with family and so forth. And maybe they're not getting along with people that they're currently stationed with or deployed with. Those are some potential risk factors. But it could be a lot of things. I'm just throwing out some common hypotheticals.
And that's in a deployed setting?
Yes. Yeah.
Okay, so what about back in the States?
Yeah, so similarly, like if they're going through family issues, maybe they're getting a divorce, maybe their kid is sick and there's nothing they can really change about it. Maybe they're sick individually and they're going through chronic pain or chronic disease. These are all concerns for the potential for depression.
Okay, so you talked about the behavioral health department. Are there other resources that soldiers have available to them?
Yeah, so we have several chaplains here on Camp Bonsteel that soldiers can reach out to, and they're always available. And then, as I mentioned before, the primary care staff, they can come talk to us as well. And then we also have Military One Source where they can call and get, I believe it's between 6 and 8 sessions for free over the phone if they just want to talk to somebody. And it's not on your medical record, it stays completely off, because I know there's sometimes soldiers feel there's a stigma involved with going to behavioral health, but and sometimes it can preclude you from certain schools and so forth, but it really depends just how stable you are, and that is determined usually by the primary care provider. For example, if someone wants to go to Ranger School and they're currently on an antidepressant, well, I'm not going to assign the school packet for them to the school physical to go unless they've been off the medication for 6 months and they've been cleared by behavioral health that they're fine and stable, that sort of thing.
Okay. So the two types of cancer that we spoke about and the mental health were the hot topics. What are your recommendations for general men's health? Yeah,
so I would probably say depression is the biggest thing we want to look out for, especially when there's signs of suicide involved. And with the military, we have the ACE program where you ask, care, and escort. So if you're seeing signs where a fellow soldier or battle buddy is feeling loss of interest in doing activities they normally do, they're not really talking to anybody anymore, potentially giving away items that you feel like they normally enjoyed and so forth, you definitely need to act and care for that soldier. And if absolutely needed, you need to take them to a provider so we can further talk to them and figure out what's going on and get them to the right place.
That covers mental health. What about just being physically healthy? Yeah,
so like I said before, with my patient population, relatively young, healthy soldiers, and specifically males, prostate cancer is usually not the top thing I'm worried about, just because it doesn't affect my age patient population. Testicular cancer I sometimes talk to soldiers, but it's fairly rare as well. So for those two specifically, if you are having urinary symptoms, if you are seeing any painless mass lump in your nether regions, you definitely want to come see a provider about it, so we can further evaluate and figure out if we need to do some blood tests, maybe urine tests, maybe go see a specialist or do some imaging.
Do you have any health recommendations outside of those specific topics?
Yeah, absolutely. Yeah, so exercise is always important. You want to try to do at least 30 minutes a day, 4 to 5 times a week, where you get your heart rate elevated. And then any strength training on that is definitely a positive. Eating right is always good. You want to make sure your plate is well balanced with vegetables, meats, and starches. And we can always get you to a nutritionist if you're having issues with that, or if you want kind of more information or more education on it. And then another big screener is tobacco use. We have an excellent tobacco cessation program where we educate you on the treatments that we have available, and then we also go over the mental obstacles that you may encounter that will help you overcome those obstacles and get you on the track to stop smoking or dipping or chewing for that matter.
So you talked about smoking in your recommendations for that. Can you talk about alcohol usage and more specifically the Audit C test?
Yeah, so that's a screening measure that whenever a patient comes in and states that they are drinking alcohol, we'll ask them several questions to include how often do you have a drink containing alcohol, how many drinks containing alcohol do you have on a typical day when you are drinking, do you ever have 6 or more drinks on one occasion, and then we usually ask them, do you ever have an eye opener where you wake up in the morning and you have to have a drink. So depending on their answers and the quantitative score, we may want to recommend for them to lower their amount of drinking, or we may want to get them to a behavioral health specialist that specializes in substance abuse, substance use, and see if they can't maybe get on the track to decreasing it or becoming completely abstinent from it.
I'm glad you mentioned the nutritionist when you talked about eating right, quote unquote, because you said a balance of meats and vegetables, and we know there's like so many different diets out there right now.
Yeah.
Is there a diet that you think is the best or the most appropriate for staying healthy?
Yeah, I mean, anything you do, whether it's the keto diet or the intermittent fasting, or for blood pressure, I often recommend the Mediterranean diet, which is more fish and so forth. You definitely want to think about it in moderation. Anecdotally, and in recent research, but the keto diet, if you're just completely eating nothing but red meat, you're going to have issues with your cholesterol. And although this diet is relatively a newer fad, we really don't know the long-term outcomes of that outside of just having high cholesterol and being at risk for heart attacks and strokes and so forth. So my biggest overall recommendation is just moderation. You don't want to go hardcore into one thing and then, you're not going to stick with it, and 2, there may be some possible side effects with going those routes.
Okay. And what do you think about a vegetarian diet?
That can be okay as well. You definitely want to make sure that you're getting sufficient vitamins with that, because sometimes you can become a little a certain electrolyte and vitamin deficient with a vegetarian diet. But yeah, I don't have an issue with it. You just want to make sure you're getting a decent amount of protein as well, because sometimes it's hard to find that in strictly vegetarian.
Okay. So a couple of tips that I have, just general health tips, are to get an annual physical exam by your primary care provider, including blood pressure and height and weight checks. Have cholesterol testing every 5 years. Screen for diabetes, thyroid disease, liver problems, and anemia. And depending on the risk factors, screen for sexually transmitted diseases and HIV infection. Is there anything that you'd like to add?
Yeah, it will just kind of alter some of those. Like it's not common to screen for thyroid condition with everyone, or liver function necessarily. And for sexual transmitted disease, that's generally an age reference range. Blood pressure, though, 18 and over, we're going to check it annually, especially with the periodic health exam assessments that we have in the military. Cholesterol, it's going to be 35 and over every 5 years, as long as it's normal. If it's abnormal, then it may be higher in frequency. And then if there's elevated body mass index, so someone's overweight or obese, then it might trigger us to order some other things, such as a thyroid lab, and then also cholesterol, even if they're under the age of 35. So yeah, I agree with most of those, but I would just caveat a couple of them.
Okay. Any just overall parting words?
Yeah, so always good to stay physically fit, especially while deployed. Not only does it help you with your endurance and just overall health physically, but it also helps with your mental health. It has been shown to help improve anxiety as well as depression with increased endorphins. So it's just stay active as much as you can, and hopefully you don't develop some of those issues. But if you do, definitely come see one of us, or if you have a battle buddy that feels like he's not himself or herself, recommend that he come see us or see one of the behavioral health reps, and we'll get him squared away.
Roger that. Soldiers, you have health insurance, so use it. Get checked out regularly. Go and see a doctor or a physician. For resources, if you want any information on any type of cancer, you can visit the American Cancer Society at cancer.org. The National Network of Depression Centers has resources for a wide variety of mental health issues like depression, suicide, post-traumatic stress disorder, and more. That's at nndc.org. And the Men's Health Network has information about everything, top to bottom, about staying healthy. If you want to visit that website, it's found at menshealthresourcecenter.com. I want to thank you, sir, for joining us today. Again, I am Specialist Thomas, and this has been a Rock or Something podcast.